How can you differentiate if the pain that you have in the knee is due to osteoarthritis of the knee or to a tear in the medial meniscus or the ACL, anterior cruciate ligament? We look at different factors to differentiate between the two. We begin with age. Typically, if the patient is over 50, we think of osteoarthritis because osteoarthritis does not occur in younger individuals, only in older individuals, unless the patient has rheumatoid arthritis. In that situation, osteoarthritis might develop early on. But if the patient comes in over age 50, we think osteoarthritis. If the patient comes in with symptoms younger, in the 30s or 20s, we think of a tear in the medial meniscus and the ACL. Then we look at the effusion, or what we call the swelling of the knee. With osteoarthritis, there is a mild swelling of the knee. It's not severe. However, with a tear, typically, if it is a severe tear, you develop a severe swelling and acute swelling, and quickly the knee swells up. Typically, the patients with a tear, they can remember, especially younger individuals, they can remember that the patient had an injury, so they twisted their knee in an accident or while walking, and especially while playing sports. Now, with osteoarthritis, there's really no injury to the patient. Now, older individuals over age 50, they can develop a tear in the medial meniscus or the ACL after a strong degeneration of the meniscus or the ACL. However, the tear is not very sudden, and typically it's not very severe, so it does not produce a lot of symptoms. Then we look for the pain. With osteoarthritis, the pain is slowly developing. So it's not overnight, it's over years. The patient will have slowly progressive pain, and the pain is typically generalized to the entire knee. With a tear, if in the medial meniscus or the ACL, it's an acute pain and it's focal pain. So the pain develops the pain over where the tear is. So typically, if it's a medial meniscus from the inside of the knee, if it's a lateral meniscus from the outside of the knee, if it's an ACL, it could be posteriorly or anteriorly on the insertion of the ACL or the PCL. Now, also we look at the stiffness of the joint. So typically with osteoarthritis, there is a stiffness in the joint, especially with range of motion, but the stiffness is mild. It's not very severe. Now, the ACL or medial meniscus tear, they can develop a stiffness, but typically the stiffness is from the swelling and the fluid inside the knee, rather than the stiffness with osteoarthritis from not a fluid movement of the joint from the osteoarthritis. And finally, we look at the stability of the knee. Typically with osteoarthritis, the knee is stable, which means that the knee does not give out on the patient. They don't lose control of the leg and they do not fall. However, with ACL and medial meniscus, especially if the tear is severe or advanced, then they can have instability of the knee because the ACL controls the movement forward and backward and rotational movement. And with the medial meniscus, is a cushion between the two bones. Therefore, they can develop instability, meaning that the leg or the knee will give out on them and they can fall from it. So as we see, there are different factors that we look between the osteoarthritis and a tear to determine the cause of knee symptoms in the patient. However, the most important thing is the physical examination that we do on the patient. So we always advise, if you have knee problem, knee symptoms from pain to swelling to stiffness or to instability, do not wait do not wait on those symptoms, and you should see a physician to determine the cause. The physician can determine the cause based on the examination or based on an imaging X-ray or an MRI. But if we wait on it because it's a weight-bearing joint, then it's going to progress, and at that point it's going to be worse and more difficult to treat. Thank you.